members this morning. On the subject of testing, pleased to report the testing is available in all 50 states. And in partnership with commercial labs across America, this morning we received word that 552,000 tests have been performed and completed all across the United States. We want to thank the American Hospital Association and hospitals across the country that are just now beginning to report in a fulsome way the results of those tests. And when the President signs the law tomorrow, it will actually be required by law. But as Dr. Birx and Dr. Fauci have explained many times at this podium, it's so important that any hospital or any lab that's doing testing report back to the CDC and FEMA so we have full visibility to provide the President with the very best counsel. Good news today on testing. Abbott Laboratories submitted to the FDA today a request for approval of a point-of-care test. This would be the kind of test where you could go to your doctor. You could get the test done there at your doctor and have the results in no more than 15 minutes. Dr. Steve Hahn will be here tomorrow to talk about progress in evaluating Abbott Laboratories' point-of-care test. Also, speaking of the FDA, on the subject of swabs, the FDA did announce earlier this week that testing symptomatic patients by swabbing from the front of the nose is perfectly appropriate, and it's already begun across the country. It allows for self-collection, and it also relieves the burden on health care protection. It saves personal protective equipment from being expended when people can administer a test themselves. And Dr. Birx will speak about the importance and the availability of swabs. With regard to supplies, you heard the President speak about what we have already shipped out from the National Strategic Stockpile. More than 9 million N95 masks for healthcare workers, 20 million surgical masks, 6,000 ventilators, and millions of gloves and gowns and face shields. In addition to that, we are working with a number of suppliers to manufacture ventilators, even while we work with state leaders to assess not just what ventilators are available in their state hospitals, but what ventilators are available in private hospitals across their state. And governors across the country are doing great work evaluating the full supply of tens of thousands of ventilators that are available. Let me also say